I think in the same way that the PCL5 is a really helpful way to have a conversation with your patients about what's going on with them in terms of their PTSD symptoms, it's also a really nice way to have a conversation with what's going on with them outside of the room. To quote Patty Ruzick, who is the developer of cognitive processing therapy, she says that, if you're only in the room for 2 hours and then you're kind of doing your own thing, the other 166 hours of the week, you're not going to have change. And I think really remembering that there's 166 or 167 hours that you're not seeing that patient, that other stuff might be happening is really important. And often you see that reflected on the PCL. So if somebody came in and they had a 10 or 15 point increase between 1 week to the next, I would be asking them to what they attributed that. I would be thinking either there was a major trigger that they hadn't been expecting, or that there was some other stressful event that might have occurred. And this would give me some initial information to know where to jump off from to ask additional questions.